Lise has talked to us about the mass grave for plague and also the effects of Ebola on burial practices in Africa. And we wanted with Misha to have a talk about the effects of the pandemic of COVID-19 on burial practices. And there have been some very serious work that has been produced in France and Switzerland by a team around Gaël Clavandier, but unfortunately they couldn't come today. And so because I myself worked in China, I could get some contacts with a researcher at Zhenmin University in Beijing, who has conducted some research not on the effect on the pandemic itself, but he has done a PhD in history on the funerary practices in the Qing dynasty, so 18th, 19th century, and who has published an article in Chinese about the effects of the pandemics on funerary practices. And so so his name is Guo Yueshan, and I'm very grateful to him that we started a conversation based on my own interest in the pandemics. I'm also grateful to Nan, who has translated this conversation in French. And I will present it in English. And then we can have a discussion with him. In English, it will be translated into Chinese. So it doesn't fluently discuss in English, but we will have a conversation with him. Just let me say a few words about how I became interested in this question of the effect of on pandemics on the treatment of the dead. My perspective is rather, to borrow a phrase that has been used here, post-humanist, that I was interested in the effect of public health policies on the killing of animals, and particularly the killing of animals to prevent the spread of epidemics to humans. And this has particularly happened in the last 20 years for birds regarding the control of influenza. But what has been done to animals, so massive killing and mostly cremation, but also burial, is also an indication, a scary indication of what could happen to humans to control an epidemic. And that's why what has been new with this pandemic of COVID-19 was the massive lockdown of cities and the impossibility for families to have contact with their dead. And so we had a conversation with Guo Yueshan precisely on how what happened in the lockdown in Wuhan in the first months of the pandemic was also an indicator of what would happen for the management of the rest of this pandemic and how it has changed funerary practices in China. So it's in some way it's about the treatment of death as indicating what happens with the rest of the epidemics, and it's changing with past practices. So the first question I asked him was the number of funeral urns in Wuhan in January, February 2020 has become an indicator of the magnitude of the COVID-19 outbreak. How were these images produced and how could they circulate? So he replied, COVID-19 is a respiratory disease that manifests itself as fever, cough, shortness of breath, muscle and joint pain, among other symptoms. Although the case fatality rate is low, it is highly contagious and can be transmitted between living beings, between objects, and between the dead and the living. The new coronavirus causes the death of an infected person, and death results in a corpse from which the virus can be transmitted to the living. In order to break the chain of transmission of the virus and maximize the safety of the living, the Wuhan municipal government decided to cremate all corpses. In traditional Chinese society, bodies are disposed by inhumation, cremation, or burial in a tree. But in this major public health and safety incident, The bodies were cremated by force on governmental order. Cremation produces ashes, which are placed in urns. So each urn represents a person, and the number of urns reflects to some extent the extent of the new epidemic's development. It is important to notice that not only those who have died of infection with the new coronavirus in Wuhan were cremated, but also those who were not infected with the new coronavirus. So the number of urns was only a measure of the extent of the development of the epidemic. So I asked him about another indicator of the epidemic, which was the death of Dr. Li Wenliang in the hospital of Wuhan, and how this death has also become an event of public mourning and public outcry. Li Wenliang, who died on February 7, 2020 at the age of 34, became a hero for alerting people to the danger of the epidemic. How was the official and social network tribute organized? He replied, Dr. Li Wenliang was an ophthalmologist at Wuhan Central Hospital in Hubei province. On December 30, 2019, he was known as the whistleblower after posting information related to the outbreak in a group of classmates on the WeChat app, and issued a warning that the virus could spread to the people. On January 8, 2020, Li Wenliang, who remained in medical position despite the danger of virus transmission, encountered a patient with unexplained viral pneumonia and was infected and developed cough and fever on the 10th, which later worsened. On February the 1st, Li Wenliang was diagnosed with new coronavirus infection and died at 9:30 p.m. on February 6, 2020, at the age of 34 after treatment of failure. On March 4, Li Wenliang was posthumously awarded the title of Model Person in the prevention and control of the new COVID-19 epidemic in the national healthcare system. On April 20, he was posthumously awarded the May 4th Medal of Chinese Youth. On February 7, the spokesperson of the National Health and Sanitation System Commission, Song Shuli, said that Dr. Li Wenliang died of the new COVID-19 during the control of the epidemic. He was treated with utmost care. Zhong Nanshan, a physician in Guangzhou, who was one of the whistleblowers against SARS in 2003, declared, "Most people consider Li Wenliang as a hero of China, and so do I. I am proud of him. He told the truth to people in December." Yu Minhong, founder of New Oriental, a private education group, said, "My heart immediately fell to the bottom of the hole. I lost my soul. My heart was instantly filled with grief and pain. I locked myself in my office and cried bitterly for half an hour." Then I asked him a question about the impact of the lockdown on funeral practices and how health authorities reorganized the work of funerary professions. So he said, Wuhan was under lockdown on January 23, 2020, and then reopened on April 8 after a period of 76 days. On January 30, 2020, the General Office of the Ministry of Civil Affairs issued an urgent notice on the effective prevention and control of the new coronavirus-infected pneumonia outbreak in funeral services, marriage registration, and other service institutions. It requested civil affairs departments nationwide to effectively strengthen the prevention and control of the outbreak in funeral services, authorities in charge of marriage legislation, homeless and beggar support and management, and mental health. On February the 1st, the National Health Commission, the Ministry of Civil Affairs, and the Ministry of Public Security jointly issued the guidelines for the disposal of remains of patients infected with novel coronavirus, which defines the relevant normative requirements and technical guidance for the treatment of cadavers of COVID patients. It aims to guide and encourage different departments and institutions to fulfill their duties and responsibilities, to smoothen procedures and work closely together in the special treatment of the cadavers of COVID patients, and to improve standardization, professionalism, and health safety. Detailed provisions are made for processes and steps such as reporting after a patient's death, sanitary treatment, transmission of procedures, transfer of corpses, protection of personnel, cremation of remains, transmission of ashes, environmental disinfection, and information management. On February the 3rd, the General Office of the Ministry of Civil Affairs has issued a document entitled Guidelines on the Treatment of Cadavers of Patients with the New Coronavirus and the Prevention and Control of Epidemics in Funeral Service Establishments, which provides detailed rules and procedures for funeral service establishments, especially funeral homes that are responsible for the treatment of patients' cadavers, disinfection of equipment and premises, and protection of staff, both from a managerial and technical point of view. This is the first time that funeral service establishments were specifically regulated and required to properly handle the treatment of patients' corpses with infectious diseases such as COVID, as well as the prevention and control of epidemics. Taking into account the particular characteristic of funeral service establishments, the guidelines establish normative requirements for the prevention and control of epidemics in funeral service establishments, specifying technical specifications for cadaver service locations and its environmental control, the protection of staff who handle the cadavers of non-COVID patients, the disinfection of equipment and facilities, waste treatment, etc. It is also emphasized that during the period of prevention and control of epidemics, the processes and steps related to funeral services should be simplified, and activities such as wakes, farewells, and memorial gatherings should not be organized in order to minimize the risk of disease transmission. On January the 31st, 2020, the Department of Civil Affairs of Hubei Province and the Provincial Health and Sanitation System Commission issued the urgent notice on the transfer and treatment of corpses of patients with the new coronavirus. The notice requires that the corpses of patients who died of a new coronavirus, including those suspected, should be cremated nearby in a timely manner and not be transferred and treated by other means such as burial. After the death of a person with COVID-19, the healthcare facility responsible for medical care should perform preventive health and epidemic treatment and issue a medical death certificate. For patients who die of COVID-19 outside of a healthcare facility, the local health and sanitation department is responsible for ensuring that the healthcare facility performs sanitary and epidemic prevention treatment and issues a medical death certificate. The notice states that the medical and health institutions shall not release the body to any work unit or person other than the funeral home to receive and transport the body. Prior to the arrival of the funeral staff, the health institution and the patient's relatives shall prepare the death certificate and the health and preventive treatment for the corpse. Upon the arrival of the funeral director, the patient's relatives and the healthcare facility complete the procedures for delivery of the body and consent to cremation on the spot. The healthcare facility must clearly indicate sanitary and epidemic funeral home issues, notice of corpse treatment to the patient's relatives. Funeral homes must transport the remains of patients, including suspects with new coronavirus infection, directly to the crematorium and return the ashes in accordance with the regulations. The notice states that each funeral home must provide a special team of funeral service personnel, a special body receiving vehicle, a special passageway, a special crematorium, and a quarantine area, and handle the bodies of patients with COVID-19 in accordance with operational procedures and standards. The funeral home must keep information and records relating to the treatment of cadavers in a secure place. The notice emphasizes that in order to cut off any possible source of infection and to protect the safety of funeral homes and funeral service staff, the remains of patients suspected of having the new coronavirus should be treated as those who are definitely diagnosed. The notice calls on local disease control department to direct funeral homes to disinfect vehicles used to transport remains, cremation equipment, and areas with which remains have come into contact, and to train funeral home personnel involved in the handling of remains in the first instance, and to equip them with the necessary protective equipment. It is reminded that the Department of Civil Affairs at all levels should guarantee basic funeral service to the people, avoid the inflation of the prices of funeral services, and provide guidance and response to public opinion. Then I asked him if the lack of contact with the disease experienced by families was experienced by families as a break in funeral practices. So he said, in traditional Chinese funeral rituals, contact between the living and the dead is necessary for such rituals as using new cotton to put it in front of the dying person's pulse to test his or her breathing, invoking the soul, bathing, putting a small amount of rice in the dead person's mouth, decorating and dressing the cadaver, wrapping a cloth around his or her head, putting an object in the hand, putting the cadaver in the coffin, and transporting the coffin to the cemetery. However, during the epidemic, the dead were transported from the place of death to the crematorium under strict protection, without the family being able to see them, let alone touch them, which constituted a constraining way of handling the body and undoubtedly a disruption of ordinary funeral practices. This phenomenon can be understood in two ways. First, in order to prevent transmission of the virus from the body of the deceased to those of the family, an important way to break the chain of transmission is to isolate the living from the deceased. And second, death can cause changes in all family ethics and social relationships, making the feelings of the living toward the deceased more complex and intense than they were while alive. Proper treatment of the body protects the safety of the family and maintains the emotional connection between the living and the deceased. By having no contact with the deceased, the family is prevented from hurting the living with the dead, which reflects the culture and spirit of traditional Chinese funeral practices. Then I asked him, has the Chinese government planned memorials to those who died from COVID-19, as it did after SARS in 2003? And he replied, during the outbreaks of COVID-19, many medical professionals were engaged in the fight against the disease, despite the risk of transmission. Unfortunately, some of them died due to the infection of the virus. Although the Chinese government has not erected memorials to these medical professionals, it has held public rituals to honor them on traditional Chinese holidays, such as the festival of visiting the ancestors' tomb, the Qingming festival. Tributes for medical professionals can be classified into three categories. The first is public tributes held by the state. The second is professional tributes held by the medical sector. And the third is personal tributes held by families. Since the deceased and the family are related by blood and are emotionally close, family rituals must be prioritized among the three categories. Rituals provide a way to respect and honor the dead and remind the living to care for life, which is also a form of public safety education. And the last question I asked him was how the history of funeral practices in China shed light on the crisis of COVID-19. And he said, during a major health crisis such as COVID-19, it is important to think about how to respect the dead and respect the body. This new epidemic made many physicians nervous because the mechanisms of virus onset and transmission were unknown. For example, it is not known which organs were attacked by the virus at the beginning. Lymphocytes were elevated in classic viral infections, but decreased in patients infected with the new coronavirus. Patients coughed but did not spit. And physicians didn't know how frozen glass-like lung lesions developed. Therefore, the bodies of infected individuals can help physicians obtain information about the pathogenesis and understand the mechanism of COVID's pathogenesis in order to develop targeted therapies. So in a way, it suggests that there was a gap of scientific research at the beginning on the effect of COVID-19 on cadavers. Is there a possibility of treating bodies in different ways? During the epidemic, the bodies of all those who died of the virus were cremated. In fact, we should ask ourselves if cremation is the only way to prevent the spread of the virus, and if burial should be allowed depending on the context. The level of knowledge and depth of understanding about dead bodies influences the behavior of funeral managers. During the prevention and control of the epidemic, the authorities had their own considerations about the relationship between the virus and people. People came first, the virus was second, and the spread of the virus had to be prevented in order to preserve people's life. In order to prevent the majority of the population from being infected with the virus, the main task of the authorities was to control the virus and prevent it from spreading to the people. And so the measures were mainly directed against the virus in the control of the epidemic. In a sense, rather than being a human body, the dead body was seen as a host to the virus and a source of infection. Therefore, it should never come into contact with a living person and should be incinerated immediately. According to Article 3 of Chapter 1 of the Wuhan Funeral Management Measures, dated December 27, 2018, the city's funeral management emphasizes the implementation of cremation. So it is clear that Wuhan is a city where the cremation is the main burial method. Most funeral authorities believe that cremation of corpses can eliminate the virus, or at least achieve the goal of not transmitting the virus to people through the corpse. Families are not allowed to have contact with the body in order to prevent the virus from being transmitted to the living. At this point, the family's feeling for the disease gave way to the lives of the living. Thus, even if the body is disinfected, wrapped and sealed, the government does not allow private burial, storage or transfer of the body, nor does it allow the family to organize funeral rituals such as farewells to the dead loved ones. And this was done by the funeral home in a centralized manner. This is a particular case during the COVID epidemic, which shows the influence of power on funeral practices. It is important to mention that this governmental approach was understood and supported by the vast majority of Wuhan residents. Funeral authorities should be encouraged to develop a humanistic philosophy of service to the deceased. Regarding the positioning of the funeral industry, although regular checks and behavior management should be strengthened, the funeral service should not be regarded as an administrative department, but rather as a service for the people whose work should be centered on the dead person, fully respecting the deceased in order to recognize the value of persons after death and their dignity, while maintaining their decency. The funeral sector should present to the people the Chinese traditional funeral history and local funeral culture. In practical work, efforts should be made to provide loving services, adopt farewell procedures, presiding words, and standardized phrases to comfort the deceased relatives, use special services such as the restoration of broken or decomposed bodies and cosmetic surgery to soothe the deceased relatives, use services such as body cleansing and dressing to help the deceased relatives, and use active and thoughtful services to relieve the deceased relatives. So our interview stopped there, and we can now ask him questions directly.
So thank you very much for these extremely fascinating answers. I'm wondering if you have a sense of how the new experiences of burial and cremation during the COVID pandemic will affect Chinese traditions in the long term. What, can you maybe speculate about which of these new elements are here to stay and which might revert to more traditional practice once the pandemic is completely over?
Translation is going on.
I'm not seeing it. I think. Also, maybe we need to tell him to turn on the Chinese channel. Is that possible? How do we do that? So. Bill, can you maybe type in a message to him asking him to turn on the Chinese channel? Should I repeat the question? Is there a way to find out if he's hearing us or if he's hearing you? Okay. So earlier you said that he only heard it. Okay, now he has the Chinese channel. So now should I repeat the question?
非常抱歉，请重复一下中文问题。
Okay, so my question was this. You mentioned some of the changes in the treatment of the dead during the ongoing pandemic. And I'm wondering whether you think that some or all of these changes will stay with us or will stay in Chinese society in the long term, even once the pandemic is over? Or is there a set of traditional expectations, maybe, that burial traditions from before the pandemic will resume once we can be absolutely sure that there is no longer a risk of infection?
好的，我先就这个问题回答一下提问，谈一下我的感想。在中国传统社会，中国是以土葬为主的方式。在新中国成立以后，在1956年，中国政府开始强行推行了火葬，并且在1985年左右，在一些大的城市更是强行推行火葬。那么在新冠肺炎发生的时候，武汉市政府 当时火葬已经成为主要的处理尸体的方式了。这就跟中国传统处理尸体的方式是不一样的。中国传统社会一直是以土葬为主，比如说我熟悉的清朝就是这个样子。从清朝一直到1949年新中国成立这一段时期，中国一直是土葬为主。只不过新中国成立之后，通过政府强有力的政策推行，火葬已经成为大城市里边主要的丧葬方式，这样就改变了我们对尸体的处理的主要方式。而这种处理方式不会因为疫情的改变而改变，因为从2019年到现在，武汉市一直是以火葬的方式来处理尸体的。即便是在疫情之后，火葬依然是大城市，像武汉这样的大城市处理火葬的方式。但是这是其中的一个不会变化的一个方面，这主要是政府的影响力对这个尸体处理方式的一个改变。那么我在思考一个问题，就是什么东西才是在处理尸体的时候是不变的？就是在中国传统社会，以及我们现在疫情比较蔓延比较厉害的现代社会，什么是不变的？就是我们对尸体本身的尊重是不变的，我们对死者之间的产生的这种感情、哀悼的感情是不变的，尤其是死者家属跟死者之间的这种亲密的关系，不会因为死者的离世而产生断裂，我们反而会因为死者在疫情期间的突然离去而感到心情更加悲伤，这种感情反而会加深了我们对死者之间的个联系。在这种情况下，我们会采用多种的方式来悼念死者，或者是通过国家祭祀，比如说在中国传统的清明节，我们会举行国家的祭祀，统一祭祀。还有一种方式就是家族内部、家庭内部的这种祭祀，这种感情是不会变的。以上只是我从这样一个侧面来回答您的问题，谢谢。
Maybe we can ask a question about the treatment of political leaders by contrasting, for example, Mao Zedong, who was kept as a body on the model of Lenin, and Deng Xiaoping, who publicly organized his cremation. So,
I can also add on this. Thank you, Frederick, for asking this, because I was debating whether I should ask or not. I thank you for your answer to the previous question when you talked about the cremation having become the most dominant form of burial from around 1960s, as far as I know. The question which was asked just now by Frederick, I wanted to add to. I remember Chairman Mao issued this ruling that first all the local party officials should sign a pledge to choose cremation. And the argument was that we should not use land for burials. We don't have enough land. And then he said everyone should become a fertilizer and I will lead the way. And of course, later he was not cremated. He was embalmed, kind of imitating Lenin's embalming. Can you say something about this, how this political argument about cremation was made and why it was not actually upheld when he died, and whether there was any kind of explanation why? Thank you.
非常感谢您的问题。我梳理了一下中国这个火葬的历史，比如说您刚才提到现代中国，也就是新中国成立以后，中国这个火葬历史是从哪个时候开始的呢？是从1956年4月27日开始的。当时很多官员都在北京，他们死后是埋在北京八宝山革命墓地的。后来是因为官员太多，八宝山的墓地不够用了，地方不够用了，所以当时就有人提出一个问题：我们这么多官员埋在那里，而且他们这个占的墓地面积是非常大的，那么过不了几年，墓地就占用完了，那么我们该怎么办？这是一个非常现实的问题。于是中央就开始讨论这个问题，怎么办呢？就是火葬。于是就在1956年4月27日，毛主席、毛泽东同志、朱德、刘少奇等等一批党和国家领导人就开始讨论，我们是应该实行火葬的。而且当时是新中国成立以后，这些领导人在中国就威望非常高。他们这个命令推行下去之后，很快就得到了一些官员以及普通老百姓的响应，他们都是认可这种行为的。当时实行火葬有2个目的，一个就是为了保证耕地面积、土地面积，另外一个就是像您说的节约土地资源，这是一个非常重要的一个资源。当时领导人都说，我们以后这些领导人死去之后都实行火化。您像那个周恩来、像朱德等等，都实行了火化。中国领导人好像有一位大将叫许世友大将，他是没有火化的，是有特殊原因的。至于毛主席为什么没有实行火化，这点我并没有做出比较深入的全面的研究，可能暂时无法回答您的问题，就是可能我得再看看材料，做进一步的研究，然后我们再进行交流。到1985年的时候，中国的国务院颁发了一个条例，名字叫《关于殡葬管理的暂行规定》，就是说在这次规定当中，首次在人口比较稠密、耕地比较少、交通比较方便的地区推行火葬，这是国务院的一个政令。这个政令是非常严厉的，如果地方官员不执行这样一个政令，是要受到处罚的。这样就通过一个强行的方式来把这火葬往全国推广。而且到1997年7月21日，国家又颁布了一个殡葬管理条例。这个殡葬管理条例跟1985年的那个规定内容是一样的，也就是说，从1985年到1997年这12年左右的时间，火葬是以强力的推行在中国推行开来的，这个力度是非常大的，一直到现在。至于武汉，据我的了解，在2019年的时候，武汉城市内部的火葬率已经达到了95%左右，肯定是90以上，95左右。所以说，火葬自然而然就成为它的一种方式。另外，就是我想跟您分享一下，我在研究中国历史的时候，提到了这个火葬。火葬主要是习俗，主要是从印度开始传过来，传入中国的。传入中国之后，很多朝代它慢慢接受了火葬这种行为。您比如说，在中国唐朝、在中国宋朝的时候，国家领导人他不排斥佛教，他接受了佛教，那么民间就开始接受火葬这种行为。在中国的明朝时期，明朝也是允许火葬的。后来，明太祖朱元璋以后，慢慢实行了一段土葬，但是到明朝后期又开始实行火葬了。从清朝入关以后，他们开始大力推行土葬制度，也就是说，中国从土葬到火葬有一个比较大的一个转变。从1644年以来， 中国是以土葬为主，这个原因主要是沿袭了满族他们的那种民族那种传统，但是这种传统被打破，也就是新中国成立以后，然后由土葬到火葬开始演变。因此，我在梳理这一段土葬跟火葬的不同的发展历史的时候，就更加清楚的了解了不同的殡葬管理方式对尸体的这个处理方式是不一样的。正是在这种不同的处理方式的过程中，我个人认为，我还是比较支持实行土葬，尽管我们现在还是大规模的实行火葬，因为土葬跟中国传统文化的联系最为紧密，流传到现在已经有3000多年的历史了。而且在土葬过程中，家属和死者能够有更加亲密的接触，这种通过物质或者通过衣服啊或者其他的形式的这种接触，能够使死者和生者之间的联系更加紧密、更加密切。这种联系是以中国人特有的那种感情为主的，在世界各地都是这样，这就是人与人之间的这种感情，而这种感情是我非常看重的这种行为。正如北京大学的哲学系教授他认为的那样，他也不同意实行大规模的那个火葬，他也提倡我们要在一定条件允许的范围内，我们可以选择那种土葬。以上是我对您的问题的回答，以及我个人对土葬和火葬的一些理解，请您批评指正，谢谢。
Thank you so much for your insights in the Wuhan burial order, which I indeed hadn't heard about. And I have a question. Did these measures or rules apply for all people who died in the epidemic, or were they restricted to people who died of COVID, or was it not possible? And if the first thing is the case, would it mean that it somehow made all people who died during the pandemic, like of mixing them with being died of the pandemic, and what did that do to Chinese people?
好的，谢谢您的问题。就是从2019年年底，开始，以及到2020年年初，武汉实行了长达70-80天的封城行为。在封城期间，武汉的疫情蔓延速度已经非常快了，感染人数也非常多了，然后就出现了一些死亡的病例。也就是说，在很短的时间内，病毒能够通过人体开始进行传播，在传播的过程当中，人们发现这病毒的导致死亡的比例其实没有那么高，但是它的传染性是非常强的。我们需要了解一个事实，武汉市是一个国际性的大城市，人口特别稠密也特别多，我们是不能允许这种病毒在大规模的传染，因此武汉市政府不得已采取了这种封城的这种行为，也是经过慎重考虑的。那么武汉，我刚才提到了一点，就是武汉市它是一个火葬为主的一个城市，也就是说，在武汉市的市民去世之后，尸体是必须以火化为主的，但是也不绝对，因为武汉市还有其他少数民族。我们对一些少数民族的处理政策是这样规定的：允许一些少数民族按照自己的民族习惯来处理尸体，所以这可能是有一些例外。但是针对所有在疫情期间死亡的那部分人，当时的规定是非常严厉的，就是必须火化， 不管是感染新冠病毒还是没有感染新冠病毒的，必须集中处理。这些人可能是在家中去世的，可能在路上去世的，也可能是在医院去世的。感染新冠病毒之后，在医院进行治疗，然后去世的。这里存在一个问题，就是好多人他是在家里边去世的，具体情况也不知道。那么就有当地的小区通知公安局，由公安局再配合殡仪馆这些殡葬管理部门，然后来统一处理尸体。也就是说，在疫情期间，所有的去世的人，不管是因为感染新冠病毒还是没有感染新冠病毒，统一采用这种火化的处理方式。因此，凯克教授提出了一个非常好的一个问题，就是在疫情期间，骨灰盒的数量其实能够反映出疫情发展的一个规模的。我在思考这个问题的时候，它的前提就是武汉市它是以火化为主的一个城市，也就是说所有人必须火化。那么火化之后，骨灰是要放在骨灰盒里边的，那么骨灰盒的数量就能够在一定程度上反映出疫情发展的一个规模以及范围。因为武汉市的一些大型的火葬场的数量是有一定的，它的数量是确定的，而且在哪些地方是确定的，主要有4个大的这个火葬场来处理尸体，这样我们大致就可以确定它疫情发展的一个分布范围以及规模和程度。但是，就是我思考了一点，就是那些因为其他原因，也就是不是因为感染新冠病毒死亡的这一部分人，他们该怎么处理？他们肯定是也放在骨灰盒里边，但是他们跟那个因为感染病毒而死亡者的这种处理方式是怎样的？恐怕我们还得有更加详细的数据来显示，因为现在我们是没有办法找到这些数据的，所以说我不能从量化的标准来回答。但是就是在研究新冠疫情在武汉蔓延这一段历史的过程中，我就发现一些问题。您比如说，好多人患新冠病毒死亡之后，很快就被医院或者殡仪馆拉走了，然后就火化了。那么，这是死者的家属应该怎么办？家属跟死者之间有那么亲密的关系，一下子亲人离去了，甚至我们没有跟亲属有过多的交流，很快亲属就被拉走，就被火化了，我们都见不到，我们没有办法做一些举办一些丧葬礼仪啊、丧葬行为来送别。在中国古代历史上，死亡是一件大事，活人为死者送葬是一件非常重大的一件事情。但是在疫情期间，这种礼仪不能够举行，家属的悲哀的感情无法得到释放，因此就好多人就生病了，甚至产生了一些精神问题，甚至心理问题。所以说，在疫情期间，那些死者固然我们应该哀悼他们，但是我们更应该关注生者，就是死者的家属，我们应该进行一些心理安慰，这个精神一些安慰，采取各种措施来做。虽然我们讨论的是死亡问题，但是我们更多关注的是生者问题。我个人认为，我们应该尊重死者，尊重死者的方式就是尊重尸体。尊重尸体，我们要尊重那些跟尸体有关的人，我们就应该尊重死者的家属。我们通过探讨死亡问题，探讨生者，然后来讨论生者，讨论活着的人，让活着的人来更加深入的探讨生命问题，探讨生存问题，以及在疫情蔓延过程中，我们如何来安顿自己的灵魂问题。这是我一直关注的比较感兴趣的问题。以上是对您的问题的一个回答，跟我自己的一些想法的一些讨论。谢谢您。
So I wanted to ask you to elaborate a little bit on something that you touched upon briefly in your answer, which is the question of ethnic diversity. So you talked to us about traditional Chinese culture and the role of burial there. And you've also talked about the more recent changes and the spread of cremation, and then specifically about the fact that in Wuhan, cremation had already been strongly established. But of course, China is a huge country that has a lot of ethnic and religious diversity. And you mentioned briefly that there were exceptions for ethnic minorities in Wuhan. And I'm wondering if you could say a few more words about differences in burial practice between urban and rural areas in China, and also between different ethnic and religious communities. And also maybe explain how these exceptions work. Is there a formal system that is established whereby if you're a proven member, for example, of a religious community or an ethnic minority, you get to perform your traditional rites? Or is it more informal and people essentially decide for themselves?
好的，非常感谢您的问题。我自己一直研究中国古代汉族的丧葬礼仪、丧葬文化，可能涉及到一点殡葬。您比如说这个土葬啊、火葬啊、树葬、海葬、鲜花葬等等各种的埋葬的方式，处理尸体的一些方式。我很少关注一些就是民族问题、宗教问题。因为在我看来，中国汉族的那种丧葬处理方式的文献已经很多了，我已经看不过来了，不能够深入的理解，所以说是个人的研究方向的限制，我就没有花那么多的时间精力关注这个民族问题跟宗教问题，所以说恐怕这个问题很难回答您。但是就是新冠疫情发生以后，武汉市当时确实是针对汉族跟少数民族之间，它有了一个不同的规定，就是武汉市的汉族人民、汉族市民去世之后是必须进行火化的。但是有一点，少数民族这些人如果感染新冠疫情之后，他也必须火化，但是在骨灰处理方式上是不一样的。这是区别，这是我对这个问题的一个了解。另外就是您提到了这个城乡之间，中国的城乡之间其实差别还是非常大的。在城市里边，火化、火葬已经成为一种主要的处理尸体的方式，而且这种方式在20世纪80年代以来，我刚才提到了，在1985年以后，国务院通过了一个关于殡葬管理的暂行规定，也就是说，在人口稠密、耕地较少、交通方便的地区推行火葬。这里边没有提到必须在城市推行火葬，也就是说，在广大的中国农村地区、乡村地区，也进一步加快了从传统的土葬到火葬的这种推广的程度，也就是说，火葬在农村地区也是开始推广。但是我们了解到一个现实，就是其实在某些中国的乡村地区，很多地方还是土葬的。也就是说，虽然国家规定了我们必须实行火葬，但是各个乡村地区它有自己的情况，它有自己的土地情况，土地资源多少啊，以及这个自己的传统观念，这个影响是非常大的。您比如说，在中国南方的一些宗族家族势力比较大的一些地区，它的传统是非常深厚的。也就是说，我们怎么处理家族成员的这种行为，有可能跟 政府倡导的这种行为并不是完全符合的，也就是说，制度规定跟实践层面它有一定的距离，但并不就是说这些人违背了我们的法律，因为我们的法律并不是一律强行推行火葬，我们允许这种弹性在个别地区。尽管这样，从1956年，或者说从1985年到现在，这几十年的时间里，火葬在中国的传播速度之快，推广速度力度之大，是难以想象的。因此，它对很多农村地区产生了非常大的一种影响。很多农村人在死去之后，他不得不接受这种火葬的这种行为。但是我们不可否认的是，很多地方还是有土葬这种行为的，这是我个人的一个了解。因此就是很遗憾，我只能针对我的了解来回答你的问题。至于民族、宗教这些问题，您提的这个观点非常好，就是说以后我在关注汉族的丧葬礼仪的时候，我再多偏重一下民族宗教的一些问题，这样我对中国的这种丧葬问题的理解就会更加全面、更加深入。谢谢您。
You suggest that the dead bodies of persons infected with the new coronavirus could have been used at the beginning of the epidemic to understand the pathology, and that it was not used because of emergency cremation, and this emergency was the problem rather than the cremation itself. Can you date the moment when dead bodies are used for medical knowledge in China and what kind of debates it has raised?
好的，谢谢您的问题。就是在新冠疫情在武汉出现已经蔓延之后，就是当时它的传播速度非常快，它的传播影响的地区也比较大，再加上武汉这是一个大城市，很多人就不知道怎么来应对这种疫情，因此好多人是医院里边怎么处理这些病人，怎么治疗，我们还不是太特别清楚。在这种情况下，我们很多的医疗措施就是跟不上，它就影响了对病人的这种治疗。后来出现一种情况，就是有一部分患者，患者的家属，他们自愿捐献自己的遗体，供医院的解剖使用。但是在刚开始的时候，自愿捐献遗体的人不是特别多，后来慢慢的就人数就多了，出现了10几位，年龄是不一样的，有些是感染新冠病毒去世之后，有些这个患者的年龄比较大，岁数比较大，感觉我把自己的身体捐献给医院之后，可以帮助更多的人，这种无私奉献的精神，很多人就受这种精神的感染，然后就把这种爱就传播开来了。因此，武汉市的一些医院，他们就通过尸体的解剖，就可以了解病毒产生的一些原理，它对人的身体不同部位，尤其是肺部产生的那种影响，了解它这个一些基本情况，然后就可以有针对的采取一些措施。当然，我们必须承认一点，并不是很多人都愿意捐献遗体的，因为在疫情出现之后，很多人 就无法接受这样一个事实，因为它的传播速度太快，很多人对它了解比较少。人去世之后，很快尸体就被送到了殡仪馆或进行了火化，有的是在医院去世的，也很快就送到了殡仪馆进行火化。这一个处理尸体的过程是非常快速的，也就是说，很多家属他不能够跟医院进行联系，他联系更多的就是殡仪馆。殡仪馆通知家属说，病人死了，我们很快就有火化了，您签署了一个允许火化的这种承诺书，然后就行了。所以这也就是影响病毒在武汉蔓延时期，为什么没有出现很多人来自愿捐献死者遗体的这种现象？我感觉这是非常合理的，从这个角度来说，也就是说，我们对疫情的理解力，对它这个爆发传播速度这个理解力没有那么及时，没有一个很好的一个处理方式。正是这种处理方式影响了对尸体的认知，以及医院对尸体的一个了解，以及对病人的一个进行的一个治疗。这是我的一些看法，可能其中有一些问题吧，我们再进行讨论。谢谢您。
More question? We can thank Guo Yueshan and the translator, William.
好，谢谢您，谢谢凯克教授。
All right.
Yeah.
So now we break for lunch.
Okay.
And we reconvene at 2:30 for Alexei Yurchak's talk about Lenin's body.
I think I might talk about Mao.